Right.
So Gemma is the lead play specialist for transplantation, and she's going to give her view from the play point of view. But she's also worked very hard for the ID patients, so she will be talking also about the other aspects of the ward.
Yeah, I was mainly going to talk about children in isolation today. So I work on Grand Union. There's myself, and then there's I have a student that works with me soon, but she's not here this week, so you won't be able to meet her. So if you see us around, you have any questions for us, you can always come and ask us. Here is Sharon. She's our new play specialist. She started with us last week, but she doesn't work on Grand Union. First of all, I just wanted to say thanks. This is brilliant what you're doing, because the children are in isolation and they do get very bored. So in the evenings and weekends when we're not there, they need play skills. So a big thank you to everyone here. So my job on Grand Union is, before the children come in, I meet them and then I try to prepare them through play about what's going to happen to them throughout their transplant. And the things that I prepare them for, it's not just them, it's the donor as well. I prepare them for their treatments and all the things that go over, like hair loss, line insertion, being in isolation in general. And to do this, I use like books, photos, teddies, real hospital equipment. So we do a lot of hospital play with the children, which may be something that you might feel confident doing yourself, because it helps to work through what's going to happen to them and they can experiment a bit. And also we do developmental play, because we're in isolation, they regress quite a lot, and therapeutic play. So that can be things like Play-Doh, messy play. Don't know if you've ever played with corn flour before. It's very therapeutic, it's very nice. It's an outlet for their emotions and express how they feel. So also play is fun and it's normal and it's what they need to do when they're in isolation. So that's what, and when they're in isolation, obviously they're away from everything that is natural for them. So friends, family, school, nursery. So it's very unnatural for them and very restrictive. And the effects, they can be lonely, bored, they can be depressed, angry, and like I said, they can developmentally regress, and it can affect their emotional and social development. So play for them is vital and it will help them. So, like I said, the play is natural and it's normal for them. So it bridges the gap between home and school. It relieves boredom and alleviates their anxiety and gives routine to them and helps continue with healthy development. And also, like the children, like Joshua said, they can be quite sick. So you might go into a cubicle and think they're too sick to play. But actually play helps aid recovery. So if they feel a bit sick, don't shy away. You know, keep asking them if they want to play. If you start playing, children naturally want to play, so they might get involved, but sometimes they might be adamant they don't want to, and you have to know your boundaries or when to actually back off. But also when you come onto the ward in the evenings or the weekends, it's really important that you get some sort of handover from the nurse in charge, or if in the evenings when I'm here, and they can just give you advice about who to see first, because you shouldn't be, say, I know it's going to be different because you're going to be seeing the active transplant children, but you shouldn't be seeing an infectious disease child and then going in to see a transplant child. You shouldn't be mixing them like that. So if you're unsure, please ask somebody, okay? Josh always said they have a family member with them, so for continuity. And when you go, it's good for them to see that their child wants to play, because they're quite nervous and it's upsetting for them to see that their child doesn't want to play and their child's sick. So it's good to try and get them involved in your play sessions. Sometimes the parents might have been in the room for a very long time and they want to use that opportunity for a break. But it'd be good to try and get them involved in the play sessions so they can see that their child still wants to play and they're happy and they're still using their bodies. You may also find the children away from their siblings and things, but at weekends a family member might come in to see the children that are in the transplant cubicles. But that means the siblings will be in the playroom. The playroom doesn't get that much usage on Grand Union because all the children in the cubicle, there's no bays. But you might find the siblings in the playroom and you might want to entertain them because they too have their own anxiety about what's going on. Their family life is disrupted. So you might want to entertain them. And also, if you're doing activities with any of the transplant children, you could try doing activities to connect them to home, maybe like write some letters, write some cards for their siblings at home so they feel connected to them. So just to summarise, just how play helps the children, because that's what you're mainly going to be doing, playing. It is natural, it's vital for healthy development, it bridges the gap between home and hospital, helps express feelings, understand their treatment, cope with isolation, and gives an outlook for feelings, and also gives them hope. And I just listed some activities in case you had no idea what to do with the children. So it was and then I'm sure you've got a good imagination. But going back to the toys that you have in the transplant cubicles, I give them toys when they come into the transplant cubicles because everything has to be brand new or really clean. So with the active transplant children, just use what's in their room. You can take art activities in, but everything has to be brand new and clean, so to avoid any infections going into the room. But with the post-transplant children that have got some white cells, you can just wipe over some of the toys with the canal wipe so that stay away from anything that's material. So just basically everything's got to be clean. Okay? So go back to what sort of activities you could do with the babies. We don't get babies with the transplant children as 2 upwards, but if you were working with any of the infectious disease children, then that would just simply engage in talking, like mobiles, noisy toys, singing, musical instruments, things with textures, anything that will engage their attention. With toddlers, you get 2-year-olds having transplants, and obviously it's very restricted for them because they're very active and want to be physical all the time, and then there's the added thing that they don't really understand what's going on. The children do have a lot of medicines running all the time, so it's hard to get them out of bed a lot, but where possible, try and get the children out of bed, even if it's just to sit on the table to do the activity. But with the toddlers, it could be just taking a ball in, sort of rolling the ball to each other, blowing bubbles, catching them, kicking them with your feet, anything that to get them going, puzzles, anything that's going to get them moving, really. And where possible, like I said, try and get them out of their bed. So a lot of the patients do just sit in their bed and regress in their bed, so we try and get them out as much as possible. Oh, and if they're feeling unwell, they're not going to want to get out of bed, so don't push them. For older children, hospital play, and with the 2-year-olds, hospital play to help them understand what's going on. With the older children, board games. Most of the transplant cubicles have got Wii's in them, so apart from one cubicle, but I usually give that patient a PlayStation or something. So the Wii is very good to keep the children active, so that you can play the Wii with them, card games, stories, and endless arts and crafts. Anything creative and arty. We do loads of art stuff because it's good to try and decorate their room as well, to make it more personal for them, so you can make things, hang things up, put it onto the walls and just make it more personal and nice, like maybe their name on the door, just so they feel like it's theirs and a bit more homely. And with the adolescents are hard because their privacy is invaded. They want to be around their friends, so they are on their phones a lot, always trying to connect with their friends. And also, it's not natural for them to be with their parents. If you can think, when you're a teenager, you don't want to have anything to do with your parents, do you? And now you're shoved into a room with them for 5 weeks at a time. So they can be a bit moody, but you can break through that quite quickly because they too get bored and they want to do things. So with them, it might be just playing on Wii or card games like Uno, and they're up for doing anything if they're that bored. You can do creative activities with them. I know Nancy's going to touch on the infection control side, and whoever wants to be with the active transplant children, you're going to spend some time with me so you can see how we do things when we go into the cubicles, like washing hands and putting our aprons on and things. And just a lot of planning with them, really. They don't, because they are bored, they don't want to play the same game of Connect 4 for 5 weeks. So yes, there's just a lot of planning to try and find some fun, exciting things for them to do. Yeah, and I think that's about it. Does anyone have any questions? I think I've touched on everything. Hang on. Oh yeah, with the teenagers, I'm sure you wouldn't, but don't befriend them on Facebook and things, or give your numbers out, because you'll get in trouble. Okay. All right, that's it. Was there any questions? Yeah.
What's the average age of a transplant child?
Well, I don't think there's an average age actually. Sometimes we get loads of 5-year-olds in at a time. At the moment we have mainly 7-year-olds at the moment.
It's difficult because we do only 4 at a time. They take a very long time. So that means in a year we will do 30. So it's not as if we are doing 500. So in theory it can be anything from, actually from 0, the normal is from 2 up to 19 years. But at any time you could have 2 5-year-olds, 1 17-year-old and 1 12-year-old. It's all right. And it just happens that depending on the slot of that time you could have an older person.
I mean, some people find the younger children more scary and some people find the adolescents more scary. For me, when I started in the hospital, I didn't know much about working with adolescents. And although I look quite young, I am actually in my 30s. So I would actually, they would think I was about the same age as them. But it took me a while to get used to it. But I actually think they're really fun once you break through the teenage stroppy stage. And you can actually have a little bit of about them. It's quite nice.
Again, if that is something that is, you have a particularly keenness in working with some age group, we can try to match it. It shouldn't be anything. And I'm sure that is for everything. It doesn't have to be for VNT. It can have an answer for ID. If you are particularly keen with a particular age group, I'm sure that's something can be.
Have we thought about, because what might be quite nice, obviously we know some children coming in and there's a long work-up period, and perhaps what we could do is actually introduce you as well, so that you get to know them a little bit in daycare before they actually go in.
Oh, yeah.
So that you actually build up a little bit of rapport with them, and that might make it a bit easier so that they're actually familiar with you, because the next time you'll see them, they'll obviously be in a very anxious state. So I say that, but some of them are really chilled. So and you'll be the one that's anxious, and they'll be.
I think as long as
it's also very variable. Some children go to a transplant period. We just had a girl who came with very severe disease, hardly no circulation into the brain. We thought it was going to be a very difficult transplant. She's out of that room 2 weeks after the transplant.
And she had absolutely no problems whatsoever, did she? It's like she hasn't had a transplant, which is amazing.
We wonder whether we gave her the chemotherapy. Maybe we have made a mistake.
And with the children, as long as they quickly suss out whether you're going to do something horrible to them, if you're not, you're there to play, they like you. So, you're their friend. Yeah. So it's quite simple. Okay, anything else?
I think the thing to remember is that you're not on your own. There's a big setup of very experienced nurses up on the ward. They're not going to leave you to it. They're going to be keeping an eye on you and go to them, and ask questions. The parents are incredibly experienced as well after they get through the first week or two. And in fact, again, they'll be keeping an eye on what you're doing because they've got that, they've got a vested interest. And they'll be. The worrying bit was probably for you is if the parent asks you a question. But again, just fill the question off.
Yeah.
We will prepare the parents before you go in. I think it's a really valuable experience. I think that'd be brilliant.
And it's what
these children are born with a condition. For the time they come to a transplant, the father or the mother knows more about the disease than you will ever know.
Yeah, totally. Yeah, you learn a lot from them.
Yeah, so they all like you if you're there to play. Because at the weekends they really miss us, and in the week as soon as they're awake, when's Gemma coming, if I fall asleep, Mummy, wake me up in case Gemma misses me. And so they just want to play. They just want to feel normal, and play is normal. Okay?
Well, I'm Nancy, and I'm the senior nurse for the transplant programme. And it's great that you're here, and there's such a lot of good of you. And I think I'm really excited about this because I think it will be really good.